there, it's me, John, and welcome to my channel. And for this clip, we will talk about common antidysrhythmic agents that you will encounter in any type of qualifying examination for nurses, or sometimes you will encounter this in your hospital experience, okay? So what I'm going to do here is that I am going to discuss the different classes of antidysrhythmic drugs, give example of each class, and give things to remember about specific antidysrhythmic agents, okay? Since this is a video clip, you're free to replay as often as you want, okay? And you can drop message if you have any clarifications or questions as we go along the way, okay? So let's identify different antidysrhythmic agents. Actually, there are 4 common antidysrhythmic drugs. You have your class 1, class 2, class 3, and class 4. So what I'm going to do, I will discuss each classes and give type or example of, okay, or medication of each different classes, okay? So you have your class 1, okay? Then you have your class 2, then we have your class 3, then we have your class 4, okay? So to make it easy to understand and comprehend, we will put this in a table, okay? Okay, class 1, class 2, class 3, and your class 4. Your class 1 antidysrhythmic drug, we call this as your sodium channel blockers. So these are your sodium blockers. Okay, your class 2 antidysrhythmic agent, we call this as your beta blockers. Your class 3, we call this as your potassium channel blockers. And then you have class 4, we call it as your calcium blockers. Okay, so these are the different antidysrhythmic drugs. Now remember, going back to the basic of your electrocardiography or your ECG, we know for the fact that when you say dysrhythmia, it refers to abnormal rhythm. An abnormal rhythm could be atrial in origin, that's your atrial dysrhythmia. Example will be your atrial flutter, atrial fibrillation. Or another example is your ventricular dysrhythmia. Example, there will be your ventricular fibrillation, right? Or ventricular tachycardia. So if a patient has dysrhythmia, okay, if the type of dysrhythmia is atrial dysrhythmia, okay, atrial problem, what sodium blocker or sodium channel blocker class 1 drug is best given to your patient? What we give here will be your PQ meds. So PQ are your class 1 sodium channel blockers best given to patient with atrial dysrhythmia. So what are these sodium channel blockers? P stands for procainamide, Q stands for your quinidine. And Q, as said, stands for your quinidine. Okay, now remember this in your NCLEX. A patient with atrial dysrhythmia, atrial flutter, atrial fibrillation. Remember the implication. A patient with atrial dysrhythmia, the heart throws clot, right? Therefore, if a clot now wanders, okay, in the systemic circulation and that clot enters the brain of the patient will have or will end up having stroke. What specific stroke is that? We call the type of stroke as your thromboembolic stroke, or other book, they call that as your ischemic stroke. Because of clot formation, aside of procainamide and quinidine, we also give to patient aspirin, okay? The reason in giving aspirin to patient is to prevent platelets to form a clot. That is why when you say aspirin, what is the classification of your aspirin drug? An aspirin is a form of salicylate that has an effect said to be antiplatelet, antipyretic, an analgesic drug, okay? Later on, I will talk about aspirin, okay? So don't forget this. A patient with atrial dysrhythmia for class 1 sodium channel blocker, we give PQ drug. Apart from PQ, we also give aspirin to patient. If the type of dysrhythmia, okay, if the type of dysrhythmia is ventricular in nature, okay, ventricular in nature, what type of sodium channel blocker is given to your patient? Well, we call that as your lidocaine. So lidocaine is a form of class 1 or sodium channel blocker best given to patient with ventricular dysrhythmia. So don't forget this. Atrial dysrhythmia, we give PQ meds. Ventricular dysrhythmia, we give L, and that's your lidocaine. Apart from your lidocaine, there is another medication given to patient with ventricular dysrhythmia, and that is what we call magnesium sulfate. What is the primary reason in giving magnesium to patient with ventricular dysrhythmia? Answer is to prevent polymorphic ventricular dysrhythmia called torsade de pois. So that is the primary reason in giving magnesium to patient with ventricular problem, okay? So this is what we call your class 1 sodium channel blocker. Your class 2 is your beta blocker drug. Don't forget this. In your anatomy and physiology, remember there are 2 common beta receptors, the beta 1 and the beta 2. What specific beta receptor controls your heart? What specific beta receptor controls your lung? Technique. Remember, okay, when you say beta 1, beta 2, the question there is, how many lungs do we have? We have the right lung and the left lung, 2 lungs. How many heart do you have? We only have 1 heart. That's our technique. So beta 1, 1 heart. Beta 1 receptor affects your heart. Beta 2, we have 2 lungs. Beta 2 affect your lungs. Therefore, if the doctor prescribes a beta 1 blocker drug, it affects your heart. If the doctor prescribes a beta 2 blocker drug, it affects your lungs. If the doctor prescribes a non-selective beta blocker, then it affects both beta 1 and beta 2. Okay? So for this clip, I will emphasize more in your beta 1 blocker drug. And remember, when you say beta blockers, these are agents that end with olol. They end with olol. One good example of your olol beta blocker is your propranolol, right? The propranolol, okay, what else? Your metoprolol. Metoprolol, that is the generic name. The brand name for that is your Betaloc, okay? Now, things to remember for your exam. Since it's a form of a beta blocker, make it sure that you have to check the heart rate of the patient. I said heart rate, that's your apical. That's your heart, not the radial pulse, not the brachial, not the popliteal, but the heart. Count the heart rate in 1 full minute. Do not give beta blocker if the heart rate of a child is less than 100. Do not give beta blocker if the heart rate of an adult is less than 60. Since it's a beta blocker, it is also said to be antihypertensive drug, right? So we cannot give beta blocker if the blood pressure of the patient is equal or less than 90/60 millimeters mercury, okay? Now highlight in your examination. If your patient takes beta blocker, take note. Once you give beta blocker, it mimics hypoglycemia. That is why one parameter you need to remember here is that you need to closely monitor the blood sugar level of your patient because, again, beta blocker may mimic hypoglycemia effect. Next, if your patient takes beta blocker for a long period of time, you have to watch out for psychosis. Don't forget that in your exam. Next, this is a common question in your NCLEX that you need to remember. What is the primary reason of non-compliance to beta blocker? The answer there is sexual dysfunction. What specific sexual dysfunction, okay, attributed to prolonged beta blocker use? Answer, impotence. I will never forget that because that thing came out in my examination. Okay, that's your beta blocker drug. Okay, next, class 3 are your potassium blockers. Remember this. Potassium blocker, one good example is your amiodarone. Okay. Amiodarone is a potassium channel blocker. Highlight in your examination. Patient taking amiodarone, you have to watch out for bluish skin discoloration that is attributed to amiodarone use. Next, If your patient takes amiodarone, you have to avoid a specific herbal med, and that is what we call your St. John's wort. Sir, why do you have to avoid St. John's wort, and what is this herbal med all about? St. John's wort herbal med is used to patient with depression. Never take St. John's wort if you're taking amiodarone, because your St. John's wort will decrease the effect of your amiodarone. So that will render your amiodarone less effective. Okay? So again, avoid St. John's wort. Okay? Again, the reason in avoiding St. John's wort is that it decreases the effect of your amiodarone. Okay? And last class is your calcium channel blocker. Now, just like your beta blocker, same parameter, check the heart rate, check the blood pressure. Never give these drugs if the heart rate of a child is less than 100, or the heart rate of an adult is less than 60, or the blood pressure is equal or less than 90/60 millimeters mercury. Okay? Now for calcium, what's your technique here? Remember, calcium is an electrolyte best absorbed together with specific vitamin. Right? Now, what is that vitamin that must be given together with calcium? Well, that is your vitamin D, VD. Am I right? So that's your technique. Example here is your VD, vitamin D, for calcium absorption. So give me an example, Sir John, of your calcium channel blocker that starts with V and another that starts with D. V stands for your verapamil. Okay? And D stands for your diltiazem. Okay? So VD are your calcium channel blockers. Okay? So these are the different antidysrhythmic agents you need to remember in your examination. So you have your class 1, sodium channel blocker, class 2, beta blocker, class 3, potassium channel blocker, and you have your class 4, your calcium channel blocker, your VD. Okay? Now, I mentioned a while ago in this first class, aspirin. Am I right? Please allow me to erase the board. Aspirin is an agent, okay, that is said to be salicylate, right? Since it is salicylate, the action of this drug is, okay, it is an anticoagulant, am I right? It is antipyretic at the same time and analgesic at the same time. So what is the difference between an anticoagulant and antiplatelet? An anticoagulant is a drug that prevents clot, okay? An antiplatelet, sorry, I need to correct myself. Aspirin is not anticoagulant. Aspirin is an antiplatelet drug, okay? So write it down. So you have your antiplatelet. Example here is your aspirin. Antiplatelet is your aspirin, not anticoagulant. What is the difference again? An antiplatelet is a drug that prevents platelet to form a clot. Remember the importance of your platelet to control bleeding. Since it prevents platelet to do its action and prevents platelet to turn a clot, a patient taking aspirin has a higher risk of bleeding tendencies. Am I right? So that will be the question now in your NCLEX. Am I right? When is the best time for you to stop taking aspirin if your patient is scheduled for invasive procedure? Okay? So these are common questions. This is a common question in your exam. Take note. Patient taking aspirin, things to remember. Patient taking aspirin. Aspirin is gastric irritant. That is why it must be taken in full stomach. Okay? If patient takes aspirin, okay, since it's an antiplatelet drug, what do you think is the best test? Okay? What do you think is the best test? The best diagnostic test that will evaluate therapeutic level of your aspirin with respect to your antiplatelet effect. Of course, that is your platelet count. Am I right? Since aspirin causes bleeding, okay, when will you discontinue aspirin prior to surgery or prior to invasive procedure? You have to discontinue aspirin at least 2 days, or that's 48 hours prior to procedure. Okay, do not forget this in your exam. Now, what about an anticoagulant? What about an anticoagulant drug? An anticoagulant is an agent that prevents clot. Okay? An example of your anticoagulant are the following. Example here will be your heparin. Okay? Another example of an anticoagulant will be your warfarin. Warfarin or your Coumadin. Now, patient taking heparin, do not forget this. Can a pregnant mother take heparin? Answer, yes. We can give heparin to pregnant mother because heparin cannot pass the placenta. Okay? We cannot give warfarin to pregnant mothers. Okay? But we can give heparin. It cannot pass the placenta. Now, what do you think is the route, okay, in giving heparin? Heparin may be given parenteral. It may be given IV. It may be given subcutaneously. Okay? Do not forget that. But there is one type of a low molecular heparin. A low molecular heparin in a form of your enoxaparin. If your patient takes enoxaparin, a low molecular type of heparin, this is only given subcutaneously. Okay? Do not forget that. Next, if your patient takes heparin, okay, what do you think is the best diagnostic test that will evaluate therapeutic level of your heparin? What do you think is the first answer in your exam and the second answer in your exam? Your technique. Look, heparin starts with letter H, right? If you put P, letter P, prior to H, it looks like PTT. Am I right? That is the first test. That is the first answer. Your PTT. If you cannot find PTT in the option, you have your APTT, right? That's your PTT. If you cannot find that in the option, your second answer will be your clotting time. Now, do not forget this in your exam. Patient taking heparin, okay, patient taking heparin, the therapeutic level of your heparin, okay, must be 2 to 2.5 times higher than the normal level, okay? The therapeutic level, okay, of your PTT, not the heparin, sorry, the therapeutic level, okay, must be 2 to 2.5 times higher than the normal level. If your patient takes heparin, okay, when will you discontinue heparin prior to procedure, prior to surgery? Answer, DC heparin at least 1 day, okay, 1 day prior to procedure, prior to surgery. If patient develops toxicity against heparin, the antidote of your heparin, okay, the antidote for your heparin will be your, of course, you have your protamine sulfate. Protamine sulfate is the antidote of your heparin toxicity, okay? Another example, okay? Another example of your anticoagulant is your warfarin. Or you call this as your Coumadin. Highlight in your exam. If your patient takes warfarin, what do you think is the route in giving warfarin? Warfarin is taken PO. Okay? And what do you think is the best diagnostic test that will evaluate therapeutic level of your warfarin? Take note, the first answer and the second answer. The first answer in your exam for warfarin is your PT. That's your prothrombin time. If you cannot find PT among the options, the second answer will be your INR. Okay, remember the statement I mentioned a while ago, the therapeutic level must be 2 to 2.5 times higher than the normal level. So if your patient takes heparin, if your patient takes warfarin, their therapeutic level must be 2 to 2.5 times higher than the normal level because you're taking these drugs. Next, if your patient takes warfarin, okay, when will you discontinue warfarin prior to procedure, prior to surgery? Technique there. Warfarin starts with W. So when will you discontinue warfarin? Discontinue that 1 week prior to the procedure, 1 week prior to the surgery. And if patient takes warfarin and develops toxicity, the antidote, okay, the antidote will be your vitamin K. Remember that good source of vitamin K will be green vegetables. That is why if your patient takes warfarin, you have to avoid eating green leafy vegetables. Okay, so this is your antiplatelet. That's your aspirin. These are what we call anticoagulant. You have your heparin and then your warfarin. Okay, apart from this, okay, I also mentioned lidocaine, okay, a while ago in your class 1 antidysrhythmic drug, which is a form of a sodium channel blocker. Remember, I said that lidocaine is best given to patient with ventricular dysrhythmia. The question, sir, is that, is this the same lidocaine given as a local anesthetic lidocaine? The answer is no. So there are two different types of lidocaine. If a lidocaine, okay, if a lidocaine contains epinephrine, it contains preservative, that lidocaine is a local anesthetic lidocaine. If it does not contain preservative, it does not contain epinephrine, that lidocaine is a form of an antidysrhythmic lidocaine. Okay? Now, question, sir, why is it that a lidocaine with epinephrine is a local anesthetic lidocaine? Because remember, an effect of your epinephrine is vasoconstriction. So when the blood vessels constrict, okay, if the blood vessels constrict because of your epinephrine agent, it prolongs the local anesthetic effect of your lidocaine, making your lidocaine as a form of a local anesthetic drug. Okay, so I hope you learned something, guys. If you have any questions or clarifications, drop a message. Okay, reach me on Facebook, okay, or in YouTube. Subscribe in the channel, The Chronicle of Medical Surgical Nursing. Okay, I hope you learned something. Bye, and see you again in the next video clip.